Have I not got it on? Sorry. We've had exactly the right kind of two introductory presentations there. Jerry, thank you very much. William, thank you as well online. We have about 20 minutes during which we can discuss this and ask our presenters for their views. Kathleen, do you have a comment before? You have a microphone? All right, and those of you online, please don't be shy. We have persons here who will take down your comments, and I'll recognize you if I can. Our first question comes from our Vice Chair, Lynn Goldman.
Thank you very much. And I also, just before I ask my question, wanted to mention that there's going to be a slight adjustment in the schedule this morning. I think the people on the web need to know this, that because of the timing of the cafeteria here at the NIEHS, that we're going to need to break for lunch earlier. Perhaps, Kathleen, you can announce this so that everybody online knows about this too.
Sure. No, one of our speakers got very caught up in bad air traffic yesterday and won't be here for the next session. So we will just make a shift slightly in that session. The overall timing will stay the same. Danya Valvi will go first, followed by Dr. Biro. After the brief break, then Juliet Legler will come on by phone. So actually that will still happen in the morning, just in a slightly different order.
Yeah, but we need to break at 10:30 for a 20-minute break instead of 11 o'clock because the cafeteria is closed from 11 to 11:30. So in other words, after Frank speaks, we need to take a break and resume at 10 of 11.
Right, there's a break after the first two talks.
All right, great.
And for the web audience, that updated agenda has been posted. So we here in the room have an outdated agenda, but the web people have the one that's been corrected as of 10 minutes ago.
Thank you so much. I just wanted to make sure that they heard that. Okay, so I had a question actually, and kind of a comment really for both speakers. If there was one thing that I could hear kind of as a unified theme, is that relatively modest changes, whether in caloric consumption, physical activity, or tweaking metabolism, can result in increasing obesity. This is a way I really hadn't thought about it before, and I think it has profound policy implications across a multitude of factors that are involved with weight and weight gain and health and metabolism. And so I was wondering if you could comment at that. And I guess the other thing that struck me, especially Dr. Heindel, when you presented some of the earlier data, I can remember where some of those studies that showed weight gains in animals, that was taken as a beneficial effect. But they, what the researchers were looking for was weight loss as a sign of adverse impact. So I think that's a very interesting observation that's been buried there in the literature without people taking much notice of it for a long time.
William, do you want to comment on that?
Question for Bill or for Jerry?
Achievable. And I think that what's challenging is that this opens the door for all sorts of potential dysregulation because we're not talking about big caloric gaps or increments for the majority of the population. And that, I think we need to distinguish that people, or make the point that people with severe obesity, this caloric gap is much greater. It's in the hundreds of calories, 700 or 800 calories for people with severe obesity to both have gained that weight and lose that weight. And I think that in the field, we've, I think, made a mistake in just assuming that if somebody has obesity, that somebody with a BMI of 32 is comparable to somebody with a BMI of 44, both in terms of the metabolic consequences and more importantly, the factors that got them there. And I think we need to be much more sophisticated about understanding the different phenotypes of obesity and what the contributing factors are.
Jerry,
so I think the fact that it doesn't take very much of a change, a small increase in calories to result in putting on weight over time really helps the idea that environmental chemicals can play roles here, because for the most part, the environmental chemical effects are not huge effects. They are just increasing the susceptibility or altering the set point. So then that has the ability to play a bigger role if you only need to have a small change.
Thank you. Those of you who are about to speak, please introduce yourself.
Bernie Goldstein, University of Pittsburgh, and the Roundtable. Jerry, this is superb work that you've done, and congratulations to you and to NIEHS for making this kind of data happen, in a sense of looking at it. Because of family reasons, I've always followed the DES story. And so I looked up quickly before I came here whether whether the people who are being followed, both the women who receive DES, their daughters, and their sons, these are separate long-term follow-up, I didn't find any obesity. Is that because not only did we not look at it in terms of toxicology studies in rats, but that we haven't looked at it in humans? I did notice you have a DES cohort listed, or is there something else happening there?
So there are several people been looking and trying for many years to link DES exposure in women to weight gain in the offspring. And you're right, we haven't been able to pin that down, and we believe the problem is we don't know for the most part the dose that women received. So if you put all the DES women together, they received huge variation in dosing, and there was huge variation in the timing. Some were in the first semester, second semester, third trimester. So when you put that all together, I think it's like trying to measure gene expression in a tissue rather than in a cell and make some sense of it. So for the most part, I think people have given up trying to find that. On the other hand, there's anecdotal data everywhere you turn where there are people who are morbidly obese and have been that way all their life and just couldn't figure out what caused it, and it turns out that they were DES daughters. So anecdotal as that is, it's still pretty interesting.
David.
Yeah, David Fukuzawa, Kresge Foundation, Roundtable member. Bill, I think this is, thank you for your slides. I think this is the third time I've seen them in 2 weeks. So at some point I'll be able to do this presentation. But I'm glad you brought up the issue on severe obesity, because I was going to also ask about that. But often you also raise bring up the data between ethnic groups in terms of the impact of obesity changes or disparities. And I'm kind of wondering, to you, Jerry, whether there's comparable data in terms of differential impact or exposure of, say, minority populations or low-income populations and chemicals.
I don't think we have that data in the EPI studies. There are some studies looking at more Mexican American populations and more African American populations, but not enough, I don't think, to be able to make a conclusion from that.
Please.
Linda McCauley, a member of the Roundtable from Emory University, and I too want to thank the two speakers for the great overview. I think the most surprising thing that you showed me was the lack of an association across socioeconomic strata. And I immediately thought about our stereotype or our assumptions about food deserts and poverty, and looking at the large picture, not seeing a poverty indicator or association with obesity. And also, I think I have questions about environmental justice and our understanding that children, poor children, are disproportionately exposed to chemicals. And so it was quite surprising to me to see that today. Thank you. Maybe you might have other comments about that.
William,
So I'm not sure that data is the data is not there because it hasn't been looked at. I'm not sure that if we looked better, we would find it.
William, do you have a comment on that?
Yeah, I think we part of the problem is that we've confused ethnicity with socioeconomic status. That doesn't mean that exposure on the macro to the kind of macro environmental factors we're talking about are homogeneous across populations. I think that we know, for example, that inner city African American communities are often in food deserts and are surrounded by fast food emporiums or corner stores that don't sell particularly healthy products. So there is this interaction. But I think that coming back to environmental exposures, that as David's question indicated, I think that we need to think about how these operate across ethnic groups, or whether they don't operate across ethnic groups, but somehow the differential prevalence of obesity among different ethnic groups has to be explained by whatever causes or contributors we're talking about. And David, thank you for the offer. I'll let you give my next lecture.
Linda.
Linda Birnbaum, member of the Roundtable and director on IEHS. Just wanted to bring up three kind of observations. The first one is and I think our first speaker talked a little bit about the issue of differential susceptibility, possibly relating to genetic differences, and that maybe some of that's coming up with the questions about ethnic differences or stuff. But I think there are approaches that we could use to test that hypothesis in some of the newer animal models that are coming out, where we could use, for example, the diversity outbred, collaborative cross, diversity cross, whatever, mice, that we see tremendous differences in susceptibility to the same dose of chemicals. And I think that might be a way we could tease some of that out. I wanted to say that I think one of the issues with the tox studies frequently not only not focusing on an increase in weight, but often not looking for it, is because many developmental tox studies in the past have not held the animals long enough to see the impact. You know, frequently the animals would be sacrificed either, you know, just before birth, soon after birth, or at weaning, or maybe even at puberty, but they weren't held up until, for example, the time where you really see the big difference in weight gain, where no one could deny the significance. And I think with some of the new paradigms that are being used, like the NTP is busy now doing its long-term studies, starting with developmental in utero exposure and holding the animals until they're 2 years of age, I think we will see some of the things that we've only have been difficult to see before. And the third thing is actually a question for you, Jerry, which is you defined the hypothesis as focusing almost entirely on in utero or infantile exposures. And I think there's some growing evidence for the possibility of preconceptional exposures. And also I was wondering about your views of the issue of pubertal exposures, which is another time where I think you could have increased susceptibility.
Okay, so you're right. So this is a very young field, and we started this field focusing on developmental exposure in utero and or neonatally. But it's just been in the last 2 or 3 years now that we realize that there are probably other sensitive windows, paternal exposure and maternal exposure before pregnancy, and it's likely that pre-puberty would be another sensitive time. Anytime there's a huge change in hormone levels, that the body is making major changes, there's going to be major changes in epigenetic regulation. And if environmental chemicals can perturb that process, then the end result will be some problem later on. So as we move forward, we're certainly going to look at other windows of exposure.
Thank you. We have time for maybe two more. Right there, please.
Barbara Corky, Boston University. I'm very much out of this environmental field, but I'm fascinated by it, and I'm quite interested in understanding what causes obesity. And as I listened to the studies that were discussed this morning, I feel as though they are primarily epidemiological correlations which form the basis for excellent hypotheses, but which so often in this field are mistaken for fact. And it doesn't do any good to our field to say X causes Y. And I think this was certainly true of the concept of food deserts or the poor populations. And the finding, in fact, that doesn't correlate, I find very gratifying, because it means a rational hypothesis was carefully tested and not proven to be correct. And I think we're going to find the same thing with many other aspects. And a number of the chemicals mentioned today need to be carefully tested, but there are about thousands of them out there, and we don't have a very good system. So one of the thoughts that I had from this is if we could have better information more publicly made available, particularly anything that's been tested in animals. It's easy to find out, as someone mentioned earlier, when something caused weight loss or alterations in development, because those things are, or tumors, those things are looked for. But weight gain, if it's there, we know nothing about it, and I'd love to see that done more.
Do we have a quick response? We have about 2 minutes left in this session. Gary?
So you're right. The field is very descriptive at this point, but we are pushing and hoping researchers will move more in the animal models to really show causality. You can't show causality actually in an epidemiology study. So if we get effects in epi studies and then can show them in the animal studies and then use modifications and knockouts and things to show a causal relationship between the exposure and the weight gain, I think then we'll have a nice picture. Linda, do you want to say something else?
I want to say something else. I'll just use this phone. I think the point is that I think people might discuss with you whether there are some kinds of observational human studies which in fact can show causality. I think if you have longitudinal studies, I think clearly that mechanistic and animal studies can provide the biological plausibility for what may be seen. And I wanted to stress that some of the exciting work that's being done to increase the number of compounds and chemicals and mixtures, because at some point we need to talk about the fact that none of us are exposed to one potential obesogen by itself. And I think that we need to realize that with some of the Tox 21 approaches that are being used, both by EPA and NIEHS, and FDA is partnering with us as well, we're not testing 1 or 10 or 100 chemicals, but we're testing thousands and thousands of chemicals through large numbers of assays. And in fact, within the past couple of years, we've added assays that are involved in the integrated pathways that are associated with obesity. And I think that will at least provide us a great deal of certainly screening and prioritization, but eventually actual understanding.
This is Bill. I'd just like to add one comment to Barbara's comments, and that is that experimental evidence, which some of which we've seen, is just one element necessary for causality. The Bradford Hill criteria are quite extensive, and very few things hold up to the consistency, the strong association controlled for other variables, temporally related dose response, and plausibility kind of criteria.
Thank you for that comment, William. And thank you, William, and thank you, Jerry, for excellent presentations. I think we are a lot smarter now than we were about a half hour ago. At least I am, from a very low base. And we are very grateful to both William and Jerry for those very telling reports. And we move on to our second session. which is going to be led by Gwen.